Okay, this is the classical presentations and the diagnosis or disease. It is from first aid. So let's start from the first one. The clinical presentations and the diagnosis. The first case is the patient's presents with some the features of gout, intellectual disability, self-mutilating behavior in a boy. Then there is Les-Nihan syndrome, SGPRT, deficiency, X-linked recessive. The next one is situs inversus, chronic ear infections, sinusitis, bronchiectasis, infertility. And the diagnosis will be Cottanger syndrome. There is a dialing arm defect affecting cilia. Blue sclera, it is the features of osteogenesis imperfecta. There is a type 1 collagen deficiency. The next one is elastic skin hypermotility of joints and increased bleeding tendency. That is Ehlers-Danlos syndrome, and it is a type 5 collagen defect, type 3 type collagen defect, serine vascular subtype of Ehlers-Danlos syndrome. Okay, so the next one is arachnodactylity lens dislocations, which is on upward and temporal aortic dissection, hyperflexible joints, and this is a case of Marfan syndrome. Okay, and it is a fibrillin defect. And the next one is arachnodactylity pectus deformity lens dislocation, and which is on downside. Okay, so this is the homocystinuria. If the lens is dislocated on the downside, that is the homocystinuria, and if the lens is dislocated on the upper and lateral side, then that is Marfan syndrome. So the features, the homocystinuria is an autosomal recessive disorder, and arachnodactylity, pectus deformity, lens dislocation. These three features will be helpful to make a diagnosis for homocystinuria. All right. So next one is capillate spots, which is unilateral, polyostotic fibrosis, dysplasia, precocious puberty, multiple endocrine abnormality. That is a McCune-Albright syndrome. That is GS protein activation mutation. All right. Okay. So capillate spot, polyostotic fibrous dysplasia, precocious puberty, multiple endocrine abnormality. That is McCune-Albright syndrome. Okay, so the next one is Meconium ileus in neonates, recurrent pulmonary infection, nasal polyp, pancreatic insufficiency, infertility or subfertility. That is for cystic fibrosis. Here, CFTR gene defect, chromosome 7, Phi508 deletion, PHC508 deletion is there, and capillate, that is for McAlbright. Okay, so let me repeat again. Meconium ileus in neonates, recurrent pulmonary infection, nasal polyp, pancreatic insufficiency, infertility or subfertility. That is for cystic fibrosis. The next one is calf pseudo hypertrophy. Calf pseudo hypertrophy. This is a muscular dystrophy, commonly Duchenne's, okay, due to X-linked recessive disorder, and here there will be friendship mutation of dystrophin gene. Friendship mutation, friendship mutation of dystrophin gene. All right. So child uses arm to stand up from squat position. That is Duchenne's muscular dystrophy. That is called a Gower sign. Next one is slow progressive muscular weakness in boys. That is Becker's muscular dystrophy. Becker's muscular dystrophy. Slow progressive muscle weakness in boys. Becker's muscular dystrophy. It is an X-linked non-friendship deletion in dystrophin. It is a less severe than that of Duchenne. The next one is infant with cleft lip or palate, microcephaly or hollow polydactylity or cutis aplasia. That is Patau syndrome. It is a trisomy 18. The next one is single palmar crease. It is a easy one. That's a Down syndrome. The next one is confusion ophthalmoplegia or nystagmus or ataxia. That is a Wernicke encephalopathy. There is confusion ophthalmoplegia or nystagmus and ataxia. That is Wernicke encephalopathy. The next one is dilated cardiomyopathy, high output heart failure, edema, alcoholism, or malnutrition. That is wet beriberi. It is a vitamin B1 deficiency. Wet beriberi is a vitamin B1 deficiency. Wet beriberi is a vitamin B1 deficiency. Alright. The next one is burning feet syndrome. Burning feet syndrome is due to deficiency of vitamin B5. Okay, so dermatitis, dementia, diarrhea. These three combinations is a pellagra, is a niacin vitamin B3 deficiency. Swollen gums, mucosal bleeding, poor wound healing, that is, or petechia. This is a scurvy, vitamin C deficiency, can't hydroxylate proline or lysine for collagen synthesis. In vitamin C, it can't hydroxylate proline or lysine for collagen synthesis. Tea and toast diet. This can make vitamin C deficiency. The next one is hemorrhagic disease of newborn with increased PT and PTT. It is a vitamin K deficiency. Hemorrhagic disease of newborn with increased PT and PTT. That is a vitamin K deficiency. The blue is black connective tissue, air cartilage, sclera. Urine turns black or prolonged on exposure. That is olfactonuria. Homogentisate oxidase deficiency, onchronosis. Let me repeat again. Okay, so blue is black connective tissue, air cartilage, sclera. Urine turns black on prolonged exposure to air. That is olfactonuria. Homogentisate oxidase deficiency, or onchronosis. The next one is chronic exercise intolerance with myalgia or fatigue, painful cramp, myoglobinuria. That is McArdle disease. Chronic exercise intolerance with myalgia, fatigue, painful cramp, myoglobinuria. So in this McArdle disease, skeletal muscle glycogen phosphorylase deficiency is present. Okay, so let me read out this one also. So infant with hypoglycemia, hepatomegaly, that is a Cori disease. It is also called deep branching enzyme deficiency or von Guericke disease. Von Guericke disease, glucose 6 phosphatase deficiency, G6PD deficiency, that is von Guericke, and deep branching enzyme deficiency, that is Cori disease. Infant with hypoglycemia or hypoglycemia. So next one is myopathy and exercise intolerance. Infantile hypertrophic cardiomyopathy, infantile hypertrophic cardiomyopathy or exercise intolerance, that is Pompe disease. Pompe disease, lysosomal alpha 1,4 glucosidase deficiency. Pompe disease, lysosomal alpha 1,4 glucosidase deficiency. Pompe disease. Cherry raised spots on macula. cherry red spots on macula, that is Tay Sachs or Niemann-Pick's, or central retinal artery occlusion. The Tay Sachs disease is a ganglioside accumulation. Ganglioside accumulation is a Tay Sachs disease. Tay Sachs disease, Niemann-Pick's disease, that is a sphingomyelin accumulation. Ganglioside accumulation, Tay Sachs disease. Sphingomyelin accumulation, Niemann-Pick's disease. Alright, so the central retinal artery occlusion. Hepatosplenomegaly, pancytopenia, osteoporosis, avascular necrosis of femoral head, or bone crisis. Let me repeat this again. Hepatosplenomegaly, pancytopenia, osteoporosis, avascular necrosis of femoral head, and bone crisis. That is a Gaucher's disease. This Gaucher's disease is glucocerebrosidase beta glucosidase deficiency. The next one is Achilles tendon xanthoma. It is a familial hypercholesterolemia. It is due to decreased LDL receptor signals. Alright, so recurrent Neisseria infection. Recurrent Neisseria infection is due to terminal complement deficiency. Terminal complement deficiency C5, C2, C9. C5 to C9 deficiency, terminal complement deficiency, it can cause repeated Neisseria, recurrent Neisseria infection. The next one, anaphylaxis following blood transfusion. It is due to IgA deficiency. Anaphylaxis following blood transfusion, it is due to IgA deficiency. Male child recurrent infections. Male child recurrent infections, no matured B cell, Bruton disease. Male child recurrent infection, no matured B cells, Bruton disease. X-linked gamma globulinemia. X-linked gamma globulinemia, Bruton's disease. That is male child's recurrent infections and no matured B cells. No matured B cells, Bruton's. So recurrent cold, non-inflamed abscess, eczema, high serum IgE level, increased eosinophils, that is hyper IgE syndrome or Job syndrome, neutrophil chemotaxis abnormalities. Hyper IgE syndrome, it is a Job syndrome, neutrophil chemotaxis abnormality. Alright, so recurrent cold abscess, recurrent cold abscess, there is non-inflamed abscess, eczema, high serum IgE, and increased eosinophils, that is a hyper IgE syndrome. The late separations increase more than that of 30 days of umbilical cord, no pus, recurrent skin mucosal bacterial infections, that is leukocyte adhesion deficiency. LAD type 1, deficiency of LFA1 integrins, recurrent infections and granulomas with catalase positive organism. Recurrent infections and granulomas with catalase positive organisms. Chronic granulomatous disease, defect of NADPH oxidase. Recurrent infections with granuloma with catalase positive, recurrent infection and granulomas with catalase positive infection, chronic granulomatous disease. Fever, vomiting, diarrhea, desquamation, rash following use of nasal pack or tampons. Fever, vomiting, diarrhea, desquamating rash following use of nasal pack or tampons, that is staphylococcal toxin shock syndrome, STSS, staphylococcal toxic shock syndrome. Strawberry tongue, that is a scarlet or Kawasaki. Scarlet fever or Kawasaki disease, strawberry tongue. Colon cancer diagnosed a few years after endocarditis. That is Streptococcus bovis. Streptococcal bovis, colon cancer diagnosed a few years after endocarditis. Abdominal pain, diarrhea, leukocytosis, recent antibiotic use, that is Clostridium difficile infection. Clostridium difficile infection, abdominal pain, diarrhea, leukocytosis, recurrent antibiotic use. Clostridium difficile infection. Flaccid paralysis in newborn after ingestion of honey. Clostridium botulinum infection, floppy baby syndrome. Clostridium botulinum infection, that is floppy baby syndrome. Flaccid paralysis in a newborn after ingestion of honey. Tonsillar pseudomembrane with bull's neck appearance, that is Corynebacterium diphtheria infections. Corynebacterium diphtheria infections, tonsillar pseudomembrane with bull's neck appearance. Back pain, fever, night sweats. Pott's disease. Pott's disease or vertebral TB. Pott's disease or vertebral TB, that is back pain, fever, night sweats. Adrenal insufficiency, fever or DIC. Adrenal insufficiency, fever, DIC, that is a Waterhouse-Friderichsen syndromes, meningococcemia. Waterhouse-Friderichsen syndrome, meningococcemia, adrenal insufficiency, fever, and DIC. Recurrent Corinne-Zelli sputum in a patient with alcohol overuse or diabetes, that is Klebsiella pneumoniae. Recurrent Corinne-Zelli sputum in a patient with alcohol overuse or diabetes, Klebsiella pneumoniae. Large rash with bullseye appearance. Erythema migrans from Iodex tick bite, Lyme disease, Borrelia. Erythema migrans from Iodex tick bite, that is Lyme disease, Borrelia. Large rash with bull's eye appearance. Ulcerated genital lesion, non-painful indurated chancre, primary syphilis, Treponema pallidum. Non-painful indurated chancre, primary syphilis, Treponema pallidum. Ulcerated genital ulcer. If there is painful with exudate, then that is called chancroid. Haemophilus ducrei. Non-painful indurated, that is chancre. Painful with exudate, that is chancroid. Chancre, it is primary syphilis, Treponema pallidum. Chancroid is Haemophilus ducrei. People accommodates but does not react to light. Neurosyphilis, ARP, Arrigil Robertson pupil. People accommodates but does not react to light. ARP, accommodates but RP, does not react to light. Accommodation present but reaction to lights is not present. Neurosyphilis, ARP, Arrigil Robertson pupil. People accommodates but does not react to light. Smooth, moist, painless, wart-like white lesion on genitals, that is condyloma lata. Condylomata lata. Condylomata lata syphilis. Condylomata lata syphilis. Painless, wart-like white lesion on the genital which is smooth, that is condylomata lata. Fever, chills, headache, myalgia following antibiotic treatment. Fever, chills, headache, myalgia following antibiotic treatment for syphilis, that is Jairus Hexamer reaction. Jairus Hexamer reaction. Jairus Hexamer reaction due to host response to sudden release of bacterial antigen. It is a host response to sudden release of bacterial antigens. Jairus Hexamer reaction. Fever, chills, headache, myalgia following antibiotic treatment for syphilis. Okay, I have just completed the 2 pages of clinical presentation and diagnosis of disease. So after this, I'll begin with page number 3rd page for this diagnosis and clinical presentation. Thank you.